So we have a phrase in medicine that pops up a lot in the ER and a lot when you're doing call in the operating room, which I do as an anesthesiologist. Call it can't cure stupid. Problem is, sometimes people are just dumb, and usually patients will be like, that was real dumb, and it was. And other times people just don't know. So before I became an anesthesiologist, and I probably should introduce myself. I'll introduce myself to you like I introduce myself to my patients. I'm Dr. Collins, like a Tom Collins, which is what you're going to want at the end of all of this. Before I became an anesthesiologist, my second career in life was a pharmaceutical chemist. So I really love drugs and I really love chemicals. They're fabulous. There's been a lot in the news lately about disinfectants being used either intravenously, meaning we inject them into you, or maybe swallowing them to help with certain types of viral infections. Just here to tell you, one, if that sounds like a bad idea to you, it's because it is. So I just thought I'd go over a little bit about why it's a bad idea to be swallowing stuff that you use to clean your toilet bowl and showers out. So to start with, let's go over the anatomy that's affected by this stuff. Your whole mucus system, we are wet, disgusting animals, starts in your nose, which drains into your mouth. Your lungs also kind of drain into your mouth as well. That all goes down your esophagus into your stomach, and then from your stomach into your intestines. There's kind of two valves, one above the stomach and one below the stomach, and they sort of stop backflush of contents from your intestines back into your mouth. Just believe me when I tell you that having fecal contents, so stuff from your intestines, make it back into your mouth is absolutely disgusting. It does totally happen when people have small bowel obstructions. The surgeons will argue the semantics with you that it's not fecal material in the mouth, but if it looks like poop and it smells like poop, and believe me, it gets all over my scrubs while I'm trying to get it out of your mouth after you fall asleep with anesthesia, call it poop. It's poop in your mouth. It's disgusting, okay? So it's really just one long tube from your butt to your mouth. That tube is full of protective mucus, which is a lubricant, helps things get from your mouth down into your intestines and out your bum. And it's full of things like bacteria. So, like, for example, your fecal weight, a piece of poop, is 75% water, 25% dry ingredients, organic material. A lot of that water is actually mucus that your intestines use to move things through. And then there's a bunch of almost half of your dry weight of your bowel movements is actually just dead bacteria. So bacteria is everywhere. Viruses are everywhere. Your mouth is full of them. You really actually don't want to get rid of them. Ask my fecal transplant patients. Good bacteria is okay and you want to keep it. So anyway, what happens when you swallow caustic materials? So alcohol, a little caustic, right? You take like a swig of some very strong alcoholic beverage like whiskey or a vodka. That's probably a better example. And it burns going down. You hear about people who drink a lot of alcohol getting ulcers in their stomach because they've burned holes in their stomach, right? They also have other issues with their esophagus from chronic irritation. So how your esophagus usually works is you get a food bolus, and your esophagus has muscles that push the food bolus methodically downwards, like squeezing a toothpaste out, okay, to make it to your stomach. What happens when you eat or drink things that cause scar tissue to form in your esophagus is the muscles don't push smoothly anymore. So these are just tiny little rubber bands like the type that you see when you go grocery shopping around your vegetables. So you try to push your food bolus down. It doesn't take much of a stricture to make your esophagus not want to pass food anymore, okay? That's what happens when you're damaging it with chemical burns. So even if you have an intact esophagus after you've swallowed something that chemically burns your esophagus or your stomach, it makes it so that you can't easily swallow food anymore. So what happens to people who've shown up, who've either accidentally ingested, which can be kids, or my adults sometimes, or my teenagers, who tried to commit suicide by swallowing caustic chemicals, is that if they survive the event, they spend the rest of their life not being able to swallow food normally, which is a major bummer because it's like no more steaks, no more cookies. Can you imagine going through life without being able to eat a cookie? I mean, that makes me sad. So anyway, it's really important to not scar down or chemically damage the esophagus because you can't pass food. So any food you put in your mouth, you have to spit back out. It's not a very satisfying way to eat in life. So the chemicals that they've been talking about, they just say disinfectants. There are a couple, then I just brought them out. There's really like 3 classes of disinfectants that you're going to use for household cleaning. The first is vinegar, good old-fashioned light acid. It's not the same type of acid that's in your stomach. I mixed some vinegar. I don't have hydrochloric acid, sadly, which is the type your stomach makes. I mixed some vinegar, which is acetic acid, a little bit of egg white to mimic protein mucus, and a little bit of disinfectant earlier. And that's kind of what you get from that, just in case you're wondering what it looks like if it does hit your stomach. Luckily, your stomach acid will neutralize some of the basic contents that come with a disinfectant, but it also releases some like toxic, noxious gases, and it'll still try to burn a hole through your stomach lining. And as you might imagine, you really don't want food in your stomach or from your esophagus anywhere in your belly or anywhere like around your heart cavity or near your liver or anything. So these are all bad ideas. So you want to keep food inside your stomach. You don't want to be burning holes from one spot to another. So that's vinegar. The next one I'm going to talk about is bleach. It seems obvious, and I think most people know you should not drink bleach. Bleach is different than other disinfectants in how it works. It has 2 things it does. The first is it oxidizes. That sounds like something that they do a lot of selling on for like laundry detergents. But let me just tell you, oxidizing is not very pleasant, okay? If you've ever had hydrogen peroxide poured on an open wound to clean it, you know that it bubbles and it burns, okay? So that's what you'd be doing if you dump some bleach into your stomach, okay? One of the things it does is it's gonna bubble and burn, okay? But even worse because of how acidic that environment is. The other thing that bleach does is it releases chlorine gas. You don't have to do much other than go to a public pool to smell chlorine gas in very low concentrations. There are toxic signs about chlorine gas everywhere at a pool. Chlorine gas is what's famously used in World War I. I think it was in part of the Wonder Woman movie that just came out like a year or 2 ago. And let me just tell you, chlorine gas, the way that they show you dying in that Wonder Woman movie, I'm pretty sure that dying from it in real life is about 1,000 times more horrific. So anyway, so that's how bleach works though. It releases chlorine gas, which goes out and kills bacteria because gas goes right through cell walls. Doesn't care if you're a bacteria, if you're a human cell, right through the cell wall and just kills everything. And it oxidizes, which means it explodes cells, including bacteria. Bleach is its own thing. You never want to mix this ever with any other kind of household cleaning agent, particularly vinegar. That's a terrible idea. Or any of the other disinfectants, because the other disinfectants have components that, when mixed with bleach, will release noxious gases that can kill you. Okay, so bleach is its own thing. It would not even occur to me that people would try to drink it, but please don't. The way that you would die from this is really awful and horrible. The next thing you have are common household disinfectants. I'm showing this one because a lot of people have these right now and they're using them in their household. The brand name that most of these are sold under is the same company that is known for bleach. So even though it says, it's like Kleenex and tissues, even though it says, well, I guess I'll just say it, it says Clorox on the cover, there's no bleach in here. This is just a disinfectant, like this is a disinfectant. Because again, you don't want to mix your average disinfectant with bleach. Bleach is its own thing and it kills things in its own special way, okay? So these wipes, for the most part, are like the spray that you use for your kitchen or your bathroom. These sprays can do a couple of interesting things. You should go watch a video, if you can, on these ammonium salts that are in here, mixing with hydrochloric acid. They don't do it with acetic acid, I demonstrate myself. It makes a nice little chemical poof. I can't put any of those videos myself because 1, I don't have rights to them, and 2, I'm on a satellite internet connection. So quite frankly, this video is going to take probably 9 to 10 hours for me to download onto the internet so that my goddaughters can watch it. This disinfectant should not be mixed with bleach, okay? And it's a strong base. So what that means is it causes chemical burns. And it causes these like slimy chemical burns if you've ever gotten really concentrated disinfectant on your hands directly, your hands will feel slimy, and that's your skin melting. Okay, so, your skin's there for a reason. But these should not be mixed with acid. They release noxious chemicals, and if you watch the videos online of this mixed with hydrochloric acid, you'll think to yourself, that's a terrible idea to put that in my stomach or esophagus. If you've ever been in doubt about how to test whether you should put something in your stomach or esophagus, screw off the cap of this, take a big whiff. If it burns your nose like a mother, your nose has just as much mucus receptors and like other stuff as your stomach. It's all one big tube. If your nose tells you that this shouldn't go in your mouth or nose, don't put it in your stomach. Okay, please. That's my little talk about disinfectants. Please don't swallow them, no matter what you hear. How they work against bacteria and viruses is not how they chemically react with the mucus and the acids in your body. There are known side effects of ingesting these liquids. One is death, okay? Like you see it with our suicides, and you see it with kids, okay? So if that's not warning enough, just think about it. You can choose in life to play as many innings as you want, because we're all going towards death. Most of us, though, would choose 9 innings over 1. This is a good way to get 1 inning in and to call it a day. The other things it can cause, if you don't die of it, is it can cause, again, severe damage to your intestinal system, okay, including your stomach and your esophagus. Again, that means no more cookies, all right? No more steak. These are like sad things in life, man. Don't do that to yourself. And lastly, I would say that there's a lot of evidence building up that apparently if you survive small ingestion of these, that it makes you maybe turn a little bit orange and possibly like a bit delusional. So it's something else to think about. Anyway, this is Dr. Collins signing off on the Can't Cure Stupid episode. If you got questions, feel free to try to get a hold of me. Again, I have satellite internet, so good luck with that. Behave yourself.